All right, welcome back. It's still the morning crossfire right here on 99.3 Nigeria Info. We've been crossing fire since 5 o'clock hour, and we're back to continue crossing more fire right here. It's Thursday, and you know what we do on Thursday? We take care of your health. Today, we're doing the same, and we'd like you to be a part of the conversation. We're expecting medical doctor, consultant, physician, and endocrinologist who'll be joining us in the studio in a matter of seconds. And we'll be talking cardiovascular risk prevention in diabetes mellitus. All right. It's very important thing to look at. It's a very important thing to talk about because it can save lives. You know, I've had a lot of stories about diabetes. Now, if you have diabetes, you can call in with your questions. You can share, your experience with us. If you know someone, probably a family member or friend, colleague, anyone who has diabetes, you can also call in and, ask your questions, share your experiences with us right here on Health Thursday on the Morning Crossfire. Even if you don't have diabetes, but you have any questions, please feel free to call in and also, have your say. You can ask your questions or you can, give us your contribution. All right, my name is Kofi Bartels. It's the Morning Crossfire and it's Health Thursday, so let's get right into it.
What is health? It's more than the absence of illness. It's the state of complete physical, mental, and social well-being. But let's delve deeper. Health is the heartbeat of life. It's the rhythm that keeps us moving forward. The pulse that echoes our vitality. It's a symphony of balance and harmony, resonating in every aspect of our existence. Health is a silent conductor, orchestrating the dance between the body and mind. It's the energy that propels us towards our dreams and aspirations. It is the foundation upon which we build our futures. So, what is health to you? Join me, Kofi Bartels, this and every Thursday for Health Thursday, 8 a.m. on the Morning Crossfire as we explore important issues affecting your health. Only on 99.3 Nigeria Info.
All right, welcome back. We'll be joined by a health practitioner, a medical doctor, that is Dr. Ukandu Igwe, MBBS, his consultant, physician, endocrinologist. And he'll be talking cardiovascular risk prevention in diabetes mellitus. It's a wide topic, but it's very, very important. If you know the meaning of these words, cardiovascular, and then, of course, risk prevention, diabetes mellitus, you will tell what we're talking about. But it's diabetes. So we're looking at diabetes. Very, very important. Please call 0201-277-0993, 0201-277-0993, and also call 0201-465-7190. That's the number for our female listeners, 0201-465-7190. All right, so that's what we're looking at. Now, reports, indicate that diabetes mellitus is one of the non-communicable diseases that contributes to the global burden of the disease. So in Nigeria, what we're told in Nigeria is that 3.9 million adults lived with diabetes. 3.9 million adults lived with diabetes in 2019. When they checked the records, and they looked at all those who were reported. All right, in 2019. All right, and they're projecting that number is going to almost double by 2045 to 6 million Nigerians living with diabetes on record. So that's a lot. It's a high number, That's the whole country. In some places, 2 countries. So it's a lot of people. Now, in Nigeria, we're told that type 2 diabetes is a major health concern that is influenced by several risk factors. Type 2 diabetes mellitus. And according to research, which was tagged a systemic review and meta-analysis of the prevalence and risk factors of type 2 diabetes mellitus in Nigeria. If you go to the National Library of Medicine, you see it there on their website. This was done in December 2024. What they said was that the risk of type 2 diabetes mellitus, that's T2DM, is greatly increased by the increased, please listen to this. Very important, listen to this. The risk of type 2 diabetes mellitus is greatly increased by the increased risk, or increased use rather, of processed foods. Processed foods, sugary drinks, and high-calorie meals among Nigerians who migrate to cities. You left the village, you came to city, and you want to do lifestyle. Then you start taking processed foods. You start taking sugary drinks, fizzy drinks. You can't keep away from it. You know, sugar is addictive. I realized when I cut down on sugary drinks, I didn't want it anymore. But the time I started taking it, when I take one, I don't know when I will just drink 2 at a go. 2 bottles at a go. I finish it. I can even drink 4. Because it is addictive. Sugar will be calling you. Market woman, market woman, market woman. Drink me, drink me. Drink me. That's what sugar will be saying. Chris, I'm here. Come and drink me. You'll be looking at everything be looking like sugar to you. Even when you see Kofi, you look at sugar. You know? So this thing is it's I don't know, that's my own experience. It's addictive. When you drink, you want more. So that's what they're saying. That those of you who came to the city, Lagos from the village, you don't want to eat your vegetable leaf anymore. You don't want to eat your apple anymore. You don't want to eat your lafun and all those things. Drink your water that you were drinking. Highest, Pami, though I'm not advertising it, because my religion, my faith doesn't allow me to do that. Now you want to be like a city boy. Take, all this mede that. Meanwhile, what are you doing to yourself? All of you who came to Lagos from the village. That's what they're saying. Maybe Dr. Igwe will tell us. So they say, go back to what you were taking in the village. That's what this report here. Go back, and Dr. Igwe will tell us whether it's true. Go back to what you were eating in the village. I used to tell people that when I was growing up, the things that they said were poor people's things, that's what the wealthy are now looking for, are paying for. You're paying a lot of money to have. Is it the oil they used to cook? Then when I was younger, the one they say the poor people used to cook, that's what now they are saying all over the internet that is a healthy one, and wealthy are looking for it. The cream that you rub on your skin. I used to use shea butter, and it was good. The guys who have the foreign one, they will laugh at you. Now people are looking for it, So anyway, that's what they're saying, that the risk of type 2 diabetes mellitus is greatly increased by the increased use of processed foods, sugary drinks, and high-calorie meals among Nigerians who migrate to the cities. Your body is not used to all this fast food. Your body is not used to. Your body is used to the village one. All right. Now, that research says that this issue is further worsened by the transition from traditional diets, high in fruits, all these things you ate in the village, high in vegetables and whole grains, to more westernized diets that are low in nutrients. Oh, Lord have mercy. Lord have mercy. All right. And I just want to say good morning to Dr. Ukandu Igwe, who is here with us, and of course has graciously agreed to come do public enlightenment. He is a consultant physician endocrinologist. Doc, good morning to you. It's good to have you. Happy New Year's.
Good morning, Kofi. Good morning, all.
Fantastic. Some people are saying, waiting be endocrinologist. I know what it is, but let's start from there. Who is an endocrinologist?
Okay, so from our biology, remember that there are different systems in the body, and the endocrine system is the system that deals with hormone secretions and their abnormalities. So an endocrinologist is the physicians who manages people with endocrine abnormalities, endocrine disorders. Let me give you some examples. So we know some common hormones like thyroid hormones, We know pituitary hormones. So those are the things within the purview of
Doc,
an
you don't carry us
endocrinologist.
go where we know.
So get back to your basic biology, really. So we know pituitary hormones. The thyroid hormones are the commonest we know.
Okay.
But the endocrinologist also has a wider range. So the commonest disorder we manage is diabetes. Diabetes is initially an endocrine abnormality. It's due to deficiency in production of insulin, which is a hormone also, or in the effect of insulin. But beyond that, there are other abnormalities that endocrinologists also encounter. As obesity is a common one. Obesity is an ever-increasing abnormality worldwide, and there are many other things within the purview of endocrinologists.
I see.
Yeah, so you have set it up quite nicely. Talked about I did say diabetes is an endocrine abnormality, but we are looking at it now more of a cardiovascular disorder.
Okay.
Yeah, it's a cardiovascular disorder. It is still an endocrine abnormality because, like I say, in the major cause of diabetes is either absolute or relative deficiency of insulin production, or impairment in the action of insulin. So I don't want us to go into
know what
the
insulin is. So
I know we had discussed about the different types of diabetes before at an earlier forum here. But we want us to focus on that theme, the cardiovascular prevention. So maybe we can have some other sessions where we talk about the causes and different types. But for today, I would like for us to talk about the cardiovascular abnormalities, which you have already.
Dear. Okay, yeah. So, you've said a lot. I'm having to go back to my dictionary. But so we're looking at diabetes now from the point of view of the heart. Is that what we mean by cardiovascular, or what do you mean when you say cardiovascular?
Okay, so cardiovascular disorders are diseases of the heart and the blood vessels.
Okay.
So in common language, those include things like heart attack, stroke, which is quite common. Yeah, stroke. Stroke is a disease of the Stroke is a disease of the blood vessels to the brain. Yeah. So stroke is due to either blockage or bursting of the vessels in the brain.
That would be like a hemorrhage, something.
Either a hemorrhage or a blockage. Yeah.
Okay. So the brain, either left side or right side?
It can be either side.
I'm trying to let you know I still remember my biology.
Yeah, correct. You're correct.
But I had a personal experience, not me. My dad had a stroke, so I got to learn from doctors like you. So I mean, I never knew or heard that stroke had anything to do with cardiovascular health. I'm sorry, diabetes.
Okay.
Yeah, so this is quite eye-opening for those who are listening like me who may not have known. But before we go further, I won't want us to take another step without properly introducing you. And so Dr. Ukandu Igwe is a consultant physician endocrinologist, like I said, MBBS Ibadan. He did his residency training at the Lagos University Teaching Hospital, Luth. So some of you may remember him from that. He's a member of the West African College of Physicians. He's a fellow of the National Postgraduate Medical College of Nigeria. He's a member of the Diabetes Association of Nigeria, member of the Association of Clinical Endocrinologists Nigeria, member of Endocrine and Metabolism Society of Nigeria. He focuses on patient education, health promotion, care of the elderly, diabetes in pregnancy, and cardiovascular health. So this is quite very important, and we are glad to have you. So Doc, what is the most important thing that people need to know about diabetes, mellitus, and cardiovascular risk prevention?
Okay, so in the introduction, I was listening to you while I was on the way. You talked about cardiovascular diseases being non-preventable diseases, right? Being an ever-increasing cause of morbidity and mortality. Before, we used to think in developing countries, but now even in Nigeria. So the advances in healthcare and have really reduced the risk of mortalities from infectious diseases, like malaria, tuberculosis, even HIV/AIDS. So we really have made a lot of improvements in managing them. People with those conditions are living almost normal life expectancy. But the non-communicable diseases are causing an ever-increasing burden on our healthcare. And those non-communicable diseases include, like I say, stroke, heart attack. There are other things like cancers, right?
Diabetes,
hypertension. So we need to focus more and more on them because they are taking a toll on our lean healthcare resources. So that's why we need to educate the public more and more on what we can do to prevent those cardiovascular mortalities and illnesses.
All right. So what you're saying is that those who have diabetes mellitus are at a risk of cardiovascular issues if they don't do certain things.
They are at increased risk than those without diabetes.
Wow.
Yeah, that's correct.
Never knew that. Because we think it's about the sugar. Ensure that you don't have a wound and all that. So if you have diabetes, you stand a risk of having a stroke.
Yes.
Oh, wow.
So let me just give you give you a little bit of a background. So when we talk about cardiovascular risk assessments, people do their annual check routinely in their offices or some people on their own, and at the end of the check they will give you a report. So you are in good health, or your risk is mild, moderate, or severe. So there's what we call cardiovascular risk calculator. So that tends to predict the risk of an individual, that is statistical risk of having something like a stroke or a heart attack within the next 5 or 10 years. So everybody has a risk, and that risk is never zero. But some people, some things make some people at increased risk. And this includes things like diabetes, whether well controlled or not well controlled, hypertension, smoking. So when you're doing that risk assessment and you impute some data, you can search online. There are some of those risk calculators that you can do by yourself. Just put in your age, put in your weight, and whether you are black or white, whether you are man or a woman. So once you impute diabetes in that risk calculator, the risk goes high.
Okay.
There are some other things like cigarette smoking that also increase.
We're going to come back in a matter of seconds.
You are listening to your number one station for talk.
99.3 Nigeria Info.
99.3 Nigeria Info. Let's talk.
In the kitchen game, there are players and then Agba Ballers. MVP, Player of the Year, 10-0, no rival. Become an Agba Baller with the new improved Maggi chicken flavor, made with a flavorful formation of onions, celery, turmeric to bring out your top game in the kitchen. Elevate the taste of your everyday dishes with delicious rich chicken flavor. Oh yeah, let's go.
New Maggi chicken flavor, my game changer.
Here you go, dear.
Mom, you didn't add milk.
No need to. Taste it and see why.
Wow, but how?
Is it milky?
Yes.
Is it creamy?
Yes.
That's Milo 3-in-1 milky and creamy for you. It's so milky. I don't need to add more milk.
I love it, Mommy.
Give your kids Milo 3-in-1, milky and creamy. It's truly milky. It contains calcium to help your champ win every day. Milo, energy to go further.
Milo! It's the choices you make that set you apart from being good to being great. My choice? Nivea Men Deep Body Lotion with Max Tech, powered by Black Carbon. Gives you both dark wood fragrance and 48-hour moisture. And my other top choice for all-day freshness, Nivea Men Deep Roll-On for 72-hour protection and fragrance with Max Tech, powered by Black Carbon. Skin is for playing it smart. Nivea is for skin.
Mom, are you going shopping?
Yes, darling.
Can you get me a Capri Sun beach ball, please, Mommy?
For sure. Wait, where do I get a Capri Sun beach ball?
There's a free beach ball inside every carton of Capri Sun, Mom.
That's right. The Capri Sun Beach Ball promo is here. There's a free beach ball inside every carton of Capri Sun. Terms and conditions apply.
Capri Sun, the taste of fun.
Okay now, dependable insurance. After God, you are the next insurance. See as the boys the Allah. All the ladies the Allah. Ensure your car protection from accidents. Unforeseen loss, you can see them. Mistakes are meant to happen. If you don't jam the car, they'll jam yours. Will you beat them? Ah yes, you will get them arrested. Your plans for that day is affected. You waste your money, you waste energy. With AXA, you can be protected.
Get the protection that pays today. Call 0700 AXA Mansa to get a motor insurance that pays. AXA, know you can.
This is not just football. This is JJ Ball X, the game where every juggle, every race counts. Here, your football skills pay off. As you raise the ball, you fit raise your account balance. So if you think you're the next JJ and the shot for you, get on the BetKing app. Use the promo code JJBollex. Tap on casino. Click on JJ Bollex to play and start winning. Remember, not for persons under the age of 18. Play responsibly.
It's my dollar day. Hallelujah, it's my dollar day. Oh yeah.
Oh yes, your Naira card is now like dollars in your pocket, as you can now shop directly on stores like Amazon, eBay, Macy's, and many more in the USA, all with your Naira card. And here's the bigger news. With African Import-Export Solutions, you can now shop anywhere in the USA, completely tax-free. That means you save thousands shopping your favorite items like the latest phones, gadgets, electronics, fashion items, auto parts, and lots more. To learn how to save thousands and get your items delivered to you in just 3 to 5 business days, visit www.africanies.com or call 0700 800 7000 today. African Import-Export Solutions, making global shopping simple for Nigerians.
All right, class, settle down. Today, let's talk about how you started your day.
We got dressed and had pancakes with John Vance 3-in-1 chocolate for breakfast.
My mom makes John Vance 3-in-1 chocolate for us too.
My mom calls it instant goodness. My sister and I always put it inside our pap. It's so yummy.
John Vance 3-in-1 chocolate is a chocolate drink made of rich cocoa, milk, and sugar. Available nationwide in stores. John Vance 3-in-1 chocolate. Enjoy instant goodness.
It's time for back to school. Looking for a reliable pen? With Big Crystal Original, forget your worries. It flows smoothly over paper. No more running out of ink. Big Crystal Original is the pen that writes up to 3 kilometers for your notes, exams, and scribblings during class. Big Crystal Original, a pen you can rely on.
What can you do in just 2 minutes? Brush your teeth, get dressed, or warm up your food. In 2 minutes, you can also buy your motor insurance with Leadway Assurance. No queues, no stress, just 2 minutes and you are set. Visit auto.leadway.com today. Leadway Assurance, ensuring happiness since 1970.
Get ready, Lekki. Experience possibilities like never before. Daystar Christian Center, Lekki, is now at a new location. From 9 a.m. on Sunday, September 14, be part of possibilities at the Lekki Coliseum, plot 14 Providence Street off Admiralty Way, Lekki Phase 1, Lagos. Experience possibilities at the Lekki Center of Daystar. Daystar Christian Center. Raising role models.
As a mom and dentist, I know the importance of strong teeth, beautiful white smile, and fresh breath. They give you the confidence to eat the right foods without worry. Speak confidently in public, and making friends is easier when you know you have fresh breath. I give my family confidence with Pepsodent's Triple Protection 1-2-3. It's 3 toothpaste in 1 to protect their teeth from holes, give them white teeth, and fresh breath. The confidence of 3 toothpaste in 1. Pepsodent's Triple Protection 1-2-3.
I'm in love. Sonia tomato mix, stand up. Is it to open? Is it to squeeze? Is it to scoop? And is it to stir?
Sonia tomato mix in a new stand-up pouch.
Is that Alfie playing football in the rain?
It's Toby Chio.
My goodness. When did he
grow up. That's it with kids, so.
It's amazing how your child grows up before your eyes. Enable their thriving development with the new NanKid 4 with HMOs to support your child's development, probiotics, and high-quality proteins to support age-appropriate growth. NanKid 4. Nourish your child's potential.
This is where the headlines meet the hot takes.
What are the feelings of people knowing that Fubara is set to return as governor of Rivers State?
We have crisis before, we have actions during, and definitely there will be some actions after.
Regulation of food prices, I think that some miracle is supposed to happen, and our magician is the president.
The farmers that you are giving directives to say you want to crash the food price, that not only farmers.
You know, some of these monies that we've continuously been taxed.
Take seriously, or they were just brought in by devil to come and make us suffer.
Kogi state government has lamented that youth take weapons and food to bandits.
Nigeria's investors who are in the diaspora are complaining. You are asking investors who are not in Nigeria to come and invest. Are you kidding me?
Stay with us on 99.3 Nigeria Info. Let's talk.
This is Morning Crossfire on 99.3 Nigeria Info.
All right, welcome back. It's still the Morning Crossfire right here on 99.3 Nigeria Info. We're talking cardiovascular risk prevention in diabetes mellitus. And we still have with us Dr. Ukandu Igwe, consultant physician and endocrinologist. And of course, it's Health Thursday. I'm Kofi Bartels. Please feel free to call and share your thoughts with us. Are you living with diabetes? Or are you caring for someone who's living with diabetes? Or are you simply concerned, about the situation? Please text or WhatsApp us now. You can WhatsApp 08095975805, 08095975805. If you or your family member or friend lives with diabetes, what's your biggest challenge? We'll talk about the cost of drugs, especially insulin, but how you find affording it, because Doc just told me a lot while we were on the commercial break. Do you have access to tests? Please share with us. Dr. Igwe, let's go back to this cardiovascular issue and the reason. How common is cardiovascular disease among Nigerians with diabetes based on what you see in the clinics and hospitals and your experience?
Cardiovascular complications are very common. They are quite common among Nigerians, and like I said, the commonest cardiovascular complications we get are things like stroke, heart attacks, and foot complications, foot ulcers, toe amputations, leg amputations. So those are more cardiovascular complications in diabetes, and they are quite common.
And what are the most important risk factors people with diabetes should be aware of? These risk factors raise the risk of heart attack or stroke, cardiovascular complications.
Okay, so we divide risk factors into the ones we call preventive, modifiable and non-modifiable. The non-modifiable risk factors are things that you cannot do anything about them. For instance, the fact that we are black. I mean, most of us, of course, we have Caucasians among us. So you cannot change your race, you cannot change your gender, you cannot change your age. Every day you increase by one year. So those are non-modifiable risk factors. Family history is also an important one. So if there's a parent who has had a cardiovascular disease like a stroke or a heart attack, that automatically increases the risk of the individual. So those are non-modifiable. But the one we tend to focus more at the modifiable ones. So if someone smokes, so smoking, I mentioned earlier, is a major cardiovascular risk. So the person will do well to stop smoking. Ask your healthcare practitioner for advice on how to stop, because sometimes it's not really easy. But people have successfully done that. So your healthcare practitioner can help you do that. So smoking is a big risk factor. Obesity is a huge risk factor as well. Obesity.
Okay. Obesity.
Sedentary lifestyle. But now I'm glad that I see a lot of Nigerians are moving around. So on Saturday morning, you see a lot of people jogging, and that really is good. So that's they are reducing their cardiovascular risk by doing that. Even in the absence of weight loss, people jog, people walk to lose weight, but I tell them that even if your weight is not coming down, you are doing well for yourself. So you need to encourage those who are already doing it to continue doing it.
Doc, some people gym for other reasons, but let's not go into that.
Yeah, there are many reasons.
Let's not go there. Okay, so risk factors: smoking. You talk about obesity. You talked about sedentary lifestyle. What about drinking? Alcohol.
Yes. Yes, alcohol. Of course, the World Health Organization says that the best amount of alcohol to consume is zero. Yes. So any amount of alcohol consumption at all increases risk of not only cardiovascular diseases, of dying from some other complications like cancers and others. So again, alcohol, the advice is that please you will do well to stop alcohol. Some people will say, we may not go into alcohol now, some people will say there might be some cardiovascular risk protection by moderate alcohol consumption, and really some studies have shown that but we do not ask someone who doesn't drink to start drinking alcohol, because you may be increasing risk of some other diseases by alcohol consumption.
Interesting. Okay, some people, you can't separate them from their appetite. I'm going to wash my mouth in the morning.
Maybe they have to make an effort.
Wash their mouth. Okay, you have to try.
Yeah.
Okay. 99.3, good morning. Welcome to South Thursday. Please give us your name, location, and contribution. Yeah.
Good morning, Dr. Suleiman, calling from Ukandu.
All right.
Yeah, I just want to, maybe later on, if we can get his social media handle. And the question that I'd like to ask is that, what factors, given the Nigerian condition, since this is a disease that is not so familiar with us, that has now come upon us, what are the main reasons why this thing has come upon us like this? What are the critical factors that have caused this disease, and how does it apply to youth as well? Thank you. There are people that have a lower age range.
Okay, all right. You got it.
Okay, yeah, thank you very much. So that's quite a good question. And in the introduction, Kofi has mentioned that one big factor responsible for us seeing more of that is the increased westernization in our society. So now, because of our lifestyle, our busy schedule, we no longer eat as healthy as we should be or we used to. So fast foods, soft drinks, and all those things. So people are consuming them more and more. So that's a big factor. Now I also mentioned sedentary lifestyle. So before you will walk for like a long distance to get to your place of work or to get to farm, but now you wake up in the morning, you get into the car or into the bus, and from the bus to the office, and you sit in the office till 5 p.m. So that is an increased factor. So those are things that we ask people to need to be intentional about it.
All right, we have another call coming through. Interesting. I'm feeling guilty as you're saying this thing. Guilt has just crept all over me. We have an next listener, 99.3. Please give us your name, location, and condition.
Good morning, Kofi Bartels.
Oh.
Good morning to your guest. Now, in the course of this issue we are discussing now, what is the role of this haba, how this agbo of a thing? What is the role? Because some people will tell you that with agbo you can cure this thing and all of that. And I noticed that more and more people are getting involved in it. So that is my question. This is Pastor Ladipo, calling from Ozile in Sarigom.
All right, Pastor Ladipo, thank you. I was asking if you could open it. So yeah, we have something Doc was showing me. Doc, this agbo that Pastor Ladipo is talking about is being touted as one of the things people can take by those who hawk it.
Yeah, so agbo is an ever-increasing topic of discussion in diabetes, and some people who have some evidence that they say they've taken something and it worked for them. But those are things that we call anecdotal evidence. Anecdotal means it works for me, but you do not have any scientific reason to recommend it to your neighbor or to your patient. At the moment, 2025, September 2025, diabetes doesn't have a cure. At least for most, more than 99.9% of people with diabetes, there's no cure. What we continue to manage with medications. So we just launched a guideline. The Endocrine and Metabolism Society of Nigeria just yesterday launched a guideline on management, prevention of diabetes mellitus. So this guideline talks about what we can do, how to. So it's guidelines both for healthcare practitioners, advocates, and other people on management of diabetes. So there are lots of things in this guideline. This guideline is indigenous, it's by Nigerians for Nigerians. We have been using guidelines from American Diabetes Association, from European Association for Study of Diabetes, and they have been fairly okay for us. But because of these issues about Agbo and other things, so we felt there was a need to get something indigenous by Nigerian professors, Nigerian professionals. So these guidelines, you may also do well to look out for it, because it's quite educative. And like I say, some of the things that are recommendations for healthcare practitioners, but also for patients.
I see. This 127 pages big.
Yeah, it's quite extensive because diabetes has a lot of things. So, for instance, let me give you a hint. So, this guideline talks about things like fasting for people with diabetes, people with Ramadan fasting. So, can I observe Ramadan fasting and Christians fasting? So, this guideline talks about it. I've not seen any guideline from any other country that talks about Christian fasting. For instance, I have seen some on Ramadan. So this guideline contains things like that.
Interesting. I'm seeing a lot here, and it's domesticated.
Yeah, exactly.
Which is fantastic. We have the people, the resources, and knowledge to match whatever is out there in the world.
Yeah.
I see a list of profs and doctors and big names who have authored this, which is quite good. Is there an e-copy?
There is an e-copy.
Oh, wow. You guys are just fantastic. Wow. So how can one access either the hard copy, get a hard copy, or e-copy of this standard of care guideline on diabetes mellitus?
So I can share the social media handle of the organization with you after the program, so people can go in there to access that or to contact the organization if they want a hard copy. I mean, some of us still want the hard copy on our shelves.
It's really good. Really good. We have more calls coming through. And before I pick the next call, it's a very important question Pastor Ladipo asked, because right now, of course, like you told me off the air while we're on break, the cost of the diabetes medication has gone up. You know, so can you speak to that? Because people are going through a lot and are forced to now go to alternatives, to take care of themselves.
Yeah, so the rising cost of the medications are a consequence of some, inflation generally, so the economy, so there are things not really within the control of the healthcare. But we, last year, I know the government gave some directive on lifting things like custom duties from the health, from medications and other medical consumables, and that should have an effect. But beyond that, the fact that we are importing a lot of the consumables we use, medications and medical equipment, increases the cost. So maybe for healthcare advocates, if we can put in a conducive environment so that some of those things can be manufactured locally, that will give a tremendous effects in reducing the cost. Our patients really are going through a lot. Have some families that spend more than 50% of their earning on medication for one person alone, and some of them are still keeping. But after a while, you see some patients say, I didn't buy that medication, and you really can't afford them much. So one option could be Nigeria could start looking at the way of some medications that and we have originator brands, but we also have some what we call generic brands that are also good. So maybe encourage some of the manufacturers of both the original brands and the generic brands to also reduce the cost in Nigeria.
Interesting. Let's look at the prevention, risk prevention for these cardiovascular, situations or complications for those who have diabetes mellitus. So what do they need to do, those who are listening right now, to ensure they don't encounter any cardiovascular issues because of their diabetes?
So the first step in prevention is always prevention. So prevention means for those who do not have diabetes, they need to take adequate steps to make sure that they do not develop it. And the first thing is to check. So 50% of people, or if I'm more than 50% in the environment, people with diabetes do not even know that they have it yet. So so the first thing is to go and check. As you're listening now, maybe just walking into a healthcare facility to check your status, check your blood pressure, check your blood sugar. So that is the first step. So if you are good, make sure you keep it good. Then beyond that, for those who already have been diagnosed with diabetes or who are living with it, so we have people living into their 90s with diabetes, and they are really doing quite well. So there are medications, like I say, available for managing those things, but make sure you consult your healthcare practitioner. So do not use medication that your neighbor is using or even your spouse is using, because the care is individualized. So the next step in prevention is make sure that your numbers are well controlled, and that is achievable. Then beyond that, there are some people that already have some of these complications. So there are also some things that we can talk about. There are some medications that can reduce those complications from progressing, or try to manage them appropriately so that they do not have an early exit from those complications.
All right, interesting. We have a next listener on the line. It's a WhatsApp call, 99.3. Please give us your name, your location, and your contribution, please.
Hello, good morning, Kofi.
Welcome.
This is Hot Mom, and I'm calling from Portugal.
Hot Mom?
Yes, please.
Amazing.
Ninja Hot Mom on social media.
Oh, wow.
Anyway, thank you. I get kind of offended when doctors say when someone has a disease, all you have to do is to take medication. It ticks me off the wrong way, because I feel like they just want people to, I feel like because of what they've been taught, based on textbook and all of that, they just follow whatever it is that is written on the textbook. Well, that's the profession, that's what they have to do, but it ticks me off the wrong way. The person I call my father today reversed his diabetes. And before I say that, I don't know if he said something in this direction, because I didn't hear it. That is why I'm responding this way. So just in case he spoke to that, I'll take back my words. But the person I called my father today reversed his diabetes simply by plant-based diet and exercise. That is what he did. And today he's good. I've also seen people that reversed their fibroid through plant-based diet. So there is no disease. I cannot say no disease, but there are so many of these diseases that are caused by our lifestyle.
Okay.
And once you have a switching lifestyle, you'll be okay.
Okay, just hold on. But you are you medical, health? Medical?
I am not.
Okay,
but
it's your experience. Okay, hold on. Niger Hot Mom, hold on. Dr. Igwe, what's your response, sir?
Yeah, thank you, Niger Hot Mom. No offense meant when I talk about medications and all that. So it's actually a valid point she raised, and we can talk about diabetes all day long. There are many aspects of diabetes that didn't go into. So there's what we call diabetes reversal, and it's an increasing term. But like I said, I gave some statistics that more than 90%, in fact more than 99% of people with diabetes are going to live with it for life, and it's not curable, and that is a fact. However, some people have been able to reverse diabetes, and diabetes reversal is defined as someone who has been able, who is able to control his blood sugar for at least 3 months consecutively without medication. And I have a few people who have been able to do that without medication, but it is rather the exception than the rule, because first thing, the things that cause diabetes, there are some of the factors are irreversible, and many people will not be able to have this reversal because some of the damage, I talked about the pancreas, the insulin production earlier. When the distortion in insulin production is advanced, there is no herb or medication that can reverse that.
Okay. What type of diabetes did your father have?
Is it type 2, sir?
Type 2. Okay. All right. The type 2, is it the advanced one or is it the type 1 that is?
Well, so yeah, I'm going to say most likely will be type 2 because type 2 still has some insulin production, so they can reverse that. So something I did not mention, like I said, that the care is individualized. That always when we are talking about them treating diabetes, the first thing is lifestyle and diets. So we do not just say medication, but I'm just giving a summary. So because we have a short time to talk about this, so we always advocate lifestyle modification in management. That includes dietary, lifestyle, and our physical activity.
Okay, that's why I talked about exercising.
Yeah.
I know of someone who sort of like reverses diabetes easily with intermittent fasting. He told me, I know him. He said he got diagnosed with type 2 diabetes. Nobody knew he had diabetes. And embarked on intermittent fasting, and boom, he went for another test, he was gone. Is that something that you have heard of before?
Yeah, so what I may not want
to,
what I'm sure I may not want to agree with you is easy. I mean, it's never easy, but he has been done and he did it. So this person most likely embarked on that shortly after diagnosis. So that's why I say that some people, when they try some of these things shortly after diagnosis, the chances of successfully reversing it are higher. But again, I have some people, I have quite some patients with reversal, but I still monitor them. Maybe every 6 months or so, you still need to come in and check. And I have had a few who have been successfully managed without medication for some time, but after a couple of years, it's progresses again.
Okay, so you can't just tell everybody, no, it has to be on a case-by-case basis.
Exactly.
Doc, before we go, we have just about a minute. Tell us about the Endocrine Metabolism Society of Nigeria, EMSON's 46th Annual General Meeting and Scientific Conference holding in Lagos.
Yeah, exactly. So holding as we speak now, we have an annual gathering of endocrinologists and people with that deal with hormones, diabetes, metabolism, and they also include pediatric endocrinologists, dietitians, nurses, pharmacists, any healthcare professional, even some people living with diabetes are there. So we usually discuss advances in endocrine disorders and recent advances, and we also talk about some local research work that has been done locally in those fields. So we also use the opportunity to network.
All right.
Yeah.
All right. Maybe next time we have you on, we'll look at because Abdullah Tivini Kodu is asking for what food they should eat. If you have diabetes. So maybe next time you come on, you talk about that and more of this enlightenment.
Okay, that would be great.
Thank you. Wish you all the best in your deliberations and your annual general meeting. And also, thanks so much for your time. It's been really enlightening. I wish you had more time. Dr. Ukandu Igwe, MBBS consultant, physician, and endocrinologist. It's been a pleasure having you, Doc.
Thank you.
Thanks a lot. Please maintain your lifestyle and just be healthy and eat well, okay? We'll be right back.
Right after this.
See, everybody with him own wahala. Every day comes with its own version of challenges, and you have to be ready to face them, because only then can you move on to the next. That's why I never miss my breakfast. Scratch that! My peak breakfast, with the nutrients and energy I need to face each day, one challenge at a time.
Every day is a good day to power on with a peak breakfast. Have you had your peak? Reach for your peak.
Meals have a way of taking
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.